In terms of the request that we had to the state for testing of our long-term care facilities, we have yet to receive the testing to give out to them for their residents, but all of our long-term care facilities, and we've seen it in our data, have been actually pushing their staff rather well into utilizing our community-based testing sites such as Heartland Health Services to get tested. And so that has actually been another great partnership and a role that Heartland has been playing for testing right now.
Absolutely. So do you know what the delay is in getting those tests from the state for residents specifically?
So I think the main delay right now that we're seeing is the sheer volume of tests that we wanted to bring into our area, along with the fact that they are prioritizing testing with the IDPH lab tests for specifically long-term care facilities. And so with that, the ones that we would be looking at were the ones that are currently having no cases in there. And so again, from a prioritization standpoint, there is still the need to do, get those values completed for the specific groups. Now, the thing to understand is that not all tests are just put in a giant bag, so to speak, and just allocated, so forth. They're really already predefined for long-term, for hospitals, for FQHCs, for other community-based testing. And then from that bucket, even furthermore, they're being, again, reassessed. And so there's multiple layers. It's not just all the tests equally distributed. It's very much a thought-out process. And so, again, we recognize that there are some areas where they are currently in, so to speak, hot zones. And so those facilities need to get tested first and foremost versus us. We recognize that. And so, in essence, it's kind of good news for us that we're not necessarily getting that push for our test sites, but at the same time, I think we all would like to get those tests available and as soon as possible for those communities.